Now more than ever, the workspace in the operating rooms and intensive care units are filled with medical equipment and hardware to hold, stabilize, and secure critical safety-sensitive monitors and clinical management devices. Different types of equipment are being added to support the surgical intervention, requiring more space in every dimension. For decades, the IV poles have supported the functions of hanging IV fluids, blood products, holding various equipment, and the surgical drapes attached to them. These traditional IV poles have significant limitations and lack any additional value for perioperative safety and throughput. They have a large base of 5 to 7 legs radiating externally over 12 inches long for stability, taking significant space. Each leg has a wheel, which even with seal casters, the legs get caught with all the electrical cables and hoses on the floor, regardless of the gauge diameter, and the wheel ball bearing becomes stuck with time. The wide footprint often rams against other essential medical equipment and the surgical team that needs to be close to the surgical bed. Any equipment attached just above the legs has no support from below and may fall in the gaps between them. Despite best efforts to lower the center of gravity by a few inches closer to the ground, these IV poles can tilt and stumble during transport over patients and valuable equipment when several devices are mounted. The lower fixed section of the IV pole has at the top a screw handle to adjust the height of the upper mobile section. This mechanism often bends, wears off, or breaks when overused with time. On the top of the upper section, the IV hooks are concentrated in a small radius, which impedes order and a clear view of all the fluids hung. Some hook designs are not ergonomic, such as the pigtail hook, requiring difficult maneuvering. These standard IV poles need multiple accessories add-ons to provide additional capacity, such as horizontal platforms to increase space for IV pumps. These accessories often get loose and fail, contributing to the hazards of valuable capital equipment. Other costly accessories, such as added electrical outlet strips, compound the problem of the spaghetti syndrome cable entanglement, compromising patient and personnel safety. Lastly, these needed accessories are difficult to maintain, clean, and improve infection control. From these pain points and safety problems, innovation is created by redesigning an entirely new concept. We introduce the Smart IV Pole, a radical new structure in one tower that eliminates the limitations of the obsolete IV pole, offering additional utility functions, all while protecting personnel and valuable medical equipment. Find out more information about the S-Tower on our website.